Good morning. This is Dan Wade, the Department of State Treasurer. I want to welcome you all to the February 2021 Ask Me Anything conference call with Treasurer Folwell. We've got a lot of things going on and a lot of things the Treasurer wants to discuss with you, so we'll get started right away.
Thank you, Dan. Thank all of you for joining us today. I know there's a lot going on with our Council of State meeting. Now, Ask Me Anything. We have a local government commission meeting today at 2:30 and a press conference in between that about reopening schools. Just wanted to welcome you all to the February meeting of Ask Me Anything. We put out a press release this morning where we applauded the Board of Trustees of the local and the state retirement systems for unanimously voting to reduce the assumed rate of return on the pension plan. It's a very nuanced subject, but as we put in the headline of the press release, this has only been done twice in the last 60 years. And this is another example of figuring out what's right, getting it right, and keeping it right. Having these high assumed rates of return doesn't fool the rating agencies. They know what the rate of return is. And I think that any time that we can be more consistent with what we're telling the rating agencies and make policy decisions that result in the plan being better funded going forward for this next generation of public service workers is very important. So with that, I think the other topic is the PPP program that we rolled out last week that pushes the power down to where it belonged all along. Primary care physicians, pediatricians, and all pharmacies as far as distributing the vaccines. There was a call yesterday with Secretary Mandy Cohen, which I consider to be an official Council of State meeting. They did not see it that way, but just to tell you what happens when you have communication without conversation. For example, when I brought up pediatricians, the response was, well, these vaccines aren't for kids. That had nothing to do with it. It had to do with people who are medically trained to administer vaccines, not to the age of the person that was going to be getting them. The other issue that I continue to look into is these vials. Some vials have 5 vaccines, some have 6 doses. Why didn't they put 10 or 20 doses? We knew that we have to vaccinate about 6 million people in North Carolina. So to have all these vaccines, vials that are too small for what the real need is something that should have been an assumption that should have been challenged a long time ago. So be glad to, and in case you're wondering, what does this have to do with us? It has everything to do with the Treasurer's Office. A, we're the largest consumer of health care in North Carolina. B, many of these essential workers are teachers who need the vaccine. C, as I said in the press release, this vaccination rollout has created, in my opinion, more death, more poverty, more illiteracy in our state. So with that, I'll be glad to answer any questions you might have.
Thank you, Treasurer. We can get started right away. Who wants to go first with a question?
I'll jump in. This is Bridget Chapman with CBS 17. I wanted to see, Secretary Mandy Cohen, did she address at all? I know she said in the past that the state doesn't have the same relationship with different local level pharmacies that other states like West Virginia has. Was this in discussion at all? I mean, what do you think about that?
I'm sorry, I couldn't hear the question. Just repeat the question, please.
So with getting local level pharmacies involved and having them be part of this process, I know in the past the state has said that North Carolina doesn't have the same relationship with some of these smaller pharmacies that other states do, and that's why they've relied, especially with the federal program with nursing homes, to have CVS and Walgreens help out with that. What do you think about that in terms of being able to get more pharmacies on board with this?
Well, there's one thing called pharmacies, but in North Carolina there's lots of different groups of pharmacies. One are called the big chains, and the others are mainly referred to as independent pharmacists. The independent pharmacists are part of a co-op's not probably the legal word, but they're part of an association, and that association is meant to, uh, uh, to be a sounding board. We have the Medical Society. We have the Pharmacists Association. The state health plan, and thank you for calling in. The state health plan has 27,000 providers of healthcare that are signed on the Clear Pricing Project. One of these providers has 125,000 patients. That doctor tells me that he has approximately 17,000 patients over the age of 65. ECU physicians, tens of thousands of patients, part of Clear Pricing. As far as the Wilmington Health, hundreds of thousands of patients. My point is that we have had months to deal with this. And as I said in the press release, I'm 62 years old. I've never been to a hospital to get vaccinated. So to put the people in North Carolina into a queue or into a structure that people of this state absolutely are not accustomed to was something that should have been. We've had months and months to think about this. I understand the hospital needing the vaccines for their workers, but let me tell you two things which may startle you. One is that we got, for example, Tryon Medical is having to send their own employees to the hospital to get vaccinated. Wilmington Health actually, maybe including Tryon Medical, actually was part of the trials to design the vaccine. They were not getting any vaccine. As far as the nursing homes are concerned, I know of a nursing home that has been really diligent about COVID. They've had less than a handful of cases. And while they've been waiting on this vaccine to come through this normal process, a large part of their population is now infected. And if I get a little passionate about this, I hope you understand the importance of what I'm getting ready to say. Guess what happened when the vaccines finally arrived? They had to turn half of them away because they can't give vaccinations to people who have COVID. It's just crazy what's going on. And then, as you've probably already seen, the tweet that came out of Atrium Health in Charlotte, where I believe it was a public relations manager who was bragging about getting the vaccine 5 and 6 weeks ago. So I just want a structure where we know where every vial has gone and who it's gone to. Let's get transparency, let's get consistency, and let's continue to challenge assumptions to get to the right outcome so that deaths will go down, poverty will not go up, and we can start attacking the loss of learning that's gone on for the last year in public education.
Good question, Bridget. We appreciate that. Do you have a follow-up?
Not necessarily a follow-up. I don't know who else is on this call, but if I sent an email, I wanted to see, are you available at all in person today before I ask more questions on here?
Sure. And I want to be,
okay.
Yeah, I want to be clear, Bridget, and with others, you shouldn't use words like this on a call like this, but we're not damning anybody. I mean, this isn't about somebody personally. This is about policy. This is about process. We're just trying to get to the right outcomes toward these things that we think are important, which is death, poverty, and illiteracy.
She got your contact information. Our city press.
Yeah. Just send us an email to the press at nctreasurer.com, Bridget. We'll set that up for you.
Perfect. Thank you.
Who wants to go next? Who's got a question?
Treasurer, this is Dave Mildenberg at Business North Carolina. A couple of things. One, you mentioned these independent physician groups. Is it your understanding they do not have any vaccines as of this today?
We are hearing anecdotally that some of the physician groups are getting some vaccines, but as put in the press release, uh, there is, like, for example, Tryon Medical right in your backyard. There's documentation about not getting vaccines, but more importantly, this is not just vaccines for the patients. I mean, they had to send their own employees to a hospital to get vaccinated, when it should be the primary care, the pediatricians, and the pharmacists who should have been spearheading this the whole way.
Yeah, I listened to part of the discussion with the secretary yesterday, and she said, if I heard it right, was that, well, the issue is we just aren't getting enough for anybody, so therefore you need to pressure, the government to send more vaccines. And yeah, that seemed to be her answer. I was wondering about the correction officers. You represent a lot of them. Are you pretty satisfied now with how their vaccine situation is, or where does that stand?
I'm not. And just to be clear, whether we're talking about adult homes or prisons and jails, the customers don't leave every day. It's the employees. A 75-year-old who's in an adult living center cannot go on the internet and go through that whole long interview process and hope they hit the right buttons, hit enter, and then be able to drive to 3 counties away to get vaccinated. And as I've said from the very beginning, that adult facilities, no matter what you want to call them, senior living, assisted living, nursing homes, all those categories, the prisons and the jails, we've always known are the hot spots, and obviously the essential workers who work in the hospitals. We've always known that those were going to be the hot spots. That's why we launched a project several months ago, to get the corrections officers tested. And, I guess it was back in June or July, Rachel Maddow on her show talked about, Goldsboro was one of the 10 hot spots in the United States. Now, you should ask yourself, why is Goldsboro, I think it was Goldsboro, why is it one of the 10 hot spots in the whole United States that Rachel Maddow would say this? It's because of a prison. I mean, we've always known, especially in rural North Carolina, where a lot of these prisons are located, it's these, you're talking about super spreaders. These are places where spreading can go on, and then they take this COVID and they take it back into their local communities and their families. And I'm not the one to opine on this. It's shocking, Dave, for you to hear me say that. But there's somebody needs to look at the transfer of, prisoners that are sick, and those that have been sick, and those that don't have any sickness at all. There's all kinds of transfers of prisoners going on across the state. I don't have I'm not the subject matter expert to figure that out. But what I'd love to have seen is a structure where people like me, and there's no guarantee that since I've had COVID, I can't get it again or can't spread it again. It's probably a low likelihood. But people like me who have had COVID need to be guarding people who have COVID. And quit transferring these people around because of the chance that more prisons could be hot spots.
Yeah. Well, could I turn to your press release on the rate of return? I was wondering, do you have a understanding of what that means? If I'm a lawmaker over at Jones Street and I see this, what does that lead me to do or believe about my investment in the appropriations for the fund?
Appropriations to the fund will be going up, and this is a 2-step process. The first process is that this is a study that we are required to do once every 5 years, and now I've completed. The previous treasurer had done it right before I got here, and it's a study that always needs to be done, and it's taken the advice of all the actuarial science about inflation about life expectancies, about when people are going to retire, the difference in life expectancies in men and women, the difference in life expectancies possibly among whatever, maybe what your occupation is. There's about 12 different speedometers or 13 different speedometers that go into calculating what our assumed rate of return is. But at the end of the day, because of all the science that goes into this, when the actuaries make a determination that we think that your assumed rate of return needs to be 6.5%, we're not obliged to take that. But if we don't take that as a board, that means the board is not taking the actuary's advice. So that's one discussion, and that vote is now behind us. The second discussion, which you're actually asking about, is the impact this is going to have on funding. And that's why we're working as closely as we can with OSBM, the legislature, the League of Municipalities, the County Commissioner Association, to some degree, the School of Government and the LGC, because this ultimately impacts small and big size governments, to make sure that we fund this reduction in the assumed rate of return, which is going to require more funding, that we do it in a way that minimalizes the impact and provides certainty to these funding entities over the next 10 years. There's only three levers to pull on. One is the 6% that the employee puts into this plan. I'm not in favor of increasing that, and I'm not against that because of Roy Cooper or Roy Williams or Dale Folwell and the kind of income that we make as state employees. I'm against that because we have hundreds of tens and tens of thousands of people who make $16, $18, $20 an hour, $40,000 a year. So when you increase the percentage that has to go in the state health plan, that makes a huge difference in their life. So I wish back in the day that this plan would have been bifurcated so that there would be one employee contribution for example, of people that made more than $75,000 a year versus those that make less than $75,000 a year. Unfortunately, that wasn't done 50 years ago. And secondly, as far as reducing the assumed rate of return, the reason that it's only been done twice in 60 years, about two treasurers, is that it's when you reduce the assumed rate of return, the fundedness of the plan goes down. So what treasurer who's trying to uphold the AAA bond rating and the fundedness of the pension plan, the two things that people most think about with the treasurer, who would ever vote or put forth a proposal to lower the funded level that makes the treasurer look bad? Well, it's because, as Governor Martin always said, Dave, doing right's rarely wrong. And we don't pick and choose which mathematics to apply. We apply it all, and that's why this was an important step going forward. And now we're going to be working with all the funders over the next few months to figure out how we smooth this out over a great number of years.
So you think like at the end of the legislature, there will be some kind of estimate on how much this is going to cost, or will it be later than that? Or?
I think it'll be before that. There'll be, you will probably, as the committees get together in the appropriations committee, you'll probably see not only the increase associated, well, this doesn't take effect until 2022 in terms of the fundingness of it.
Right.
Okay. The assumed rate of return is in effect now, but how we fund that is really not going to kick in until next year. That's why we're trying to get out in front of it as far as these stakeholders are concerned.
But are you thinking this in the hundreds of millions of dollars or less than that?
I think collectively, when you look at the counties and the state and the city and the cities, I think you could be looking at that amount.
Yeah.
And just to be clear, and I don't want to bore anybody, this is a new phenomenon of the last few years.
Yeah.
There are less people paying into the plan than are not. That doesn't mean that everybody who's not paying in the plan is retired. It just means they're vested, not yet drawing.
Yeah.
And so when you have less people paying into the plan than are not, interest rates at 1%, life expectancies, especially for females, increasing, which is a blessing, and people retiring earlier than everybody ever thought. Those are 4 big mathematical headwinds that are not emotional nor political.
Yep. Oh, one other question, and I get out of here, is the debt affordability. I should know this, but where is that at? Is there a study going on right now in terms of how much? Because there seems to be some dispute over, how much of a bond the state should float for broadband and 20 other things.
Yeah.
Where is that?
Great question. The debt affordability study was due to the General Assembly yesterday and to the governor. We had a choice, and as chair of the Debt Affordability Commission, with consultation with other members, I made the choice not to bake in BAKE, not to bake in the more pessimistic revenue projections that we had from last May, which is the last time we had consensus numbers. Our consensus revenue number is something that OSBM and the General Assembly fiscal staff generally agree on.
Yep.
And I thought those numbers were too pessimistic, which it would have artificially, it would just not been a good way to present a debt affordability study that people have relied on for decades. And so I am waiting for OSBM and fiscal research to come together with a consensus number. All the work regarding the debt affordability is done. The only ingredient left is the consensus number on revenue. And once that number is given to us, we can put it into the oven immediately and spit out the debt affordability study.
Gotcha. And that's likely in the next week or two, or?
Mid-February.
Yeah, mid-February, or our hope, to be ultra safe here, our hope is to have it out by St. Patrick's Day, but we hope that it happens before that. But your other question that was embedded in the question is, all these needs that we have. We can't be overstimulated or with the seduction of low interest rates. Low interest rates are fantastic. It allows you to get more of whatever it is you're buying. But we know how to issue debt. We just got to get the why right. Why are we doing this? Why are we choosing broadband versus capital expenditures and for universities or K-12 education or community colleges? And that's why I'm going to be pushing this year a constitutional amendment to restore the lottery, 40% of the lottery proceeds back to public school construction. This will be specifically of interest, especially to rural communities who do not have the population growth to float bonds. And more importantly, that they can use this money for repair and renovation and not just force them into building new schools. There are a lot of good bones, BONES, out in public schools in North Carolina. Things that can be done to schools that just have good bones to them that can bring them up to the 21st century. And I want this lottery money to be restored. It can't all be done in 1 year, but to be restored and then push that money out to the local school boards, many of whom cannot really float debt, either through referendum or otherwise, so that we can get these capital needs met, especially in rural North Carolina.
Thanks, Dave. Unless you have anything else, we'll move on to the next question. Anyone?
Hi, this is Chip Hornet from the Bond Buyer. I just wanted to get your thoughts about pension bonds. They've been very popular last year. They've been going way up. I wanted to what do you think about it?
You're breaking
Chip,
up there, Chip.
Chip,
Yeah.
you got an interesting first name because either you're in my mind or you're in my computer this morning at 10 minutes till 5, because I sent an email about this very subject this morning to my staff as a result of an article that you just did on this subject. So thank you for joining us today. I think that issuing pension bonds to meet unfunded liabilities is different for different entities. It seems like, and you can correct all of us actually, starting with me, Chip, it just seems like that most of the entities that are utilizing the pension bonds are associated with plans that aren't as secure and solvent as ours is. But I'm always interested in new information or a better way of looking at old information regarding pension bonds. But obviously, just to kind of simplify all this, it's a bet and it's an arbitrage that you can borrow money at one interest rate and invest it at a higher interest rate. And but you have the floor, Chip, if you want to add anything to that.
No, I don't, sir. That's correct.
Hey, Chip, we're having a hard time hearing you, but are you, I mean, we're one of the top 5 pension plans in the United States. Are you seeing any plans that have the characteristics of ours issuing bonds?
No, not at all.
Okay.
Not at all.
Would you advise it?
I would have a choice.
Okay. All right. But I just want to tell you that the work you do at Bond Buyer is something that that we pay attention to very closely. So thank you for what you do.
Thank you, Governor. Thank you very much, sir.
So there's another question. Who has something they want to ask the treasurer?
Now, Chip, are you still with us?
Yes, I am.
I'm sorry to sort of humiliate myself on a call like this, but are you seeing people defease their GASB liability with unfunded health care?
I must admit that I don't know.
Okay.
I'll say it that way. Truthfully, I don't know.
Because I do have a $28 billion unfunded health care liability, so I'd be really interested in your answer to that question. And that's a different arbitrage because the cost of health care is going up at 3 times higher than the rate of inflation, and the bonds are priced on risk-free rate of return plus the rate of inflation. So that'd be a whole different dynamic, I'd imagine.
Oh yeah, OPEB is always different. Yeah, and healthcare is gone crazy.
Yeah.
And especially now with people not exactly sure what the next move from DC is going to be on healthcare. It's a big question marks.
Well, the move's going to be transparency, and anybody that's not in favor of it is going to be on the wrong side of history.
Yep.
Hey, have one last opportunity here to ask a question for the treasurer. If not, we'll go to the closing remarks.
All right. Thank you all for joining us. I want to thank staff for putting this together. First Tuesday of the month, as you know, we're Facebooking live the Council of State meetings. That requires a lot of effort, and we were pleased today to have Lieutenant Governor Robinson and Commissioner of Labor Dobson there. And I suspect in the March meeting, we'll have a majority of the Council of State in person. We hope that the governor will do what we're doing in this building, which is to figure out how to convene a room so that the Council of State can meet in person and not have a time clock on it. And then this afternoon we have the local government commission meeting at 2:30. I know that a lot of people on the call have been connecting into the LGC meetings. We've got a lot of stuff going on at the LGC this month, and as always, I want to thank the staff that's sitting here in front of me and for accepting the culture that we've been building now for 4 years, and that is that all of you who have called into this call today have a job to do. And as keeper of the public purse, our job is to help you do yours. And that's why we work hard to be the most transparent and responsive public agency, not just in North Carolina, but anywhere.
Right. Well, thank you all very much, and we'll look forward to talking with you again next month.